Very good morning. It's still morning. So nice to see you all. I was here last year. I've been here for a few years. I gave the first AI talk in 2023 when Dr. Ishwar Chandra, he invited me to radiology department. And this is my 5th year in AI. It's really nice to see you all. So I think most of my previous speakers have already covered most of the things. So that's one big advantage of coming a bit later in the session. I don't have to be repeating those. So I'm just going to talk something which the others have not touched upon. I'm a radiology consultant. I specialize in children and also cancer imaging. And now my latest passion is AI. So I'm conscious of the time. So I'm based in London. And I also do a lot of projects in India with the different governments. So a radiologist is now taking on a bigger role. It's not like the olden days where we were just reporting. So we do all this now. Especially in UK, we are moving into a more like a specialized role. So we are not anymore issuing the reports. So radiology becomes the center of the hospital. And over the next 3 to 4 years, this is going to become more and more obvious. So all I want is, I just condensed these 4 points, important. Radiologist detects, triages, controls the workflow, and regulates. So these are the 4 main functions of the radiologist. And all this is done with AI. And that's what we do in King's College and in UCLH in London. And every winning department is not a department which has loads of algorithms. I think what's important is one operating model. That's what is important. So if you have lots of algorithms and none of those are validated or none of those are working, then it's pointless. Now, this is the right moment. Things are happening so quickly. You know, within a month, the knowledge is outdated. Every day, you have to keep updating yourself in AI. So it's so fast. It's going like a tsunami. No one expected that, really. I think 3 or 4 years back, we were discussing whether AI is really going to make it or not. But today, I think human beings are just being swept by that big wave called AI. There's no sphere which is left untouched by AI. So the most important things, there are 4 forces that converge in the imaging department. One is the demand is constantly rising. AI is helping us with that. And then evidence is maturing. So we're becoming more and more confident, less hallucinations, less mistakes. And regulation is tightening. So MHRA in UK, we have ICMR in India, we have FDA in America. So all these are really tightening the news. And the foundation models, that's my previous speakers, all of them touched upon it. So as you can see here at the bottom, 76% of devices are approved. And these are like radiology devices. So radiology is still very much in the forefront, right at the top. 44% mammographies. You can see that the screen reading workload is reduced. I have 3 colleagues who do breast radiology in my department, but now their workload has significantly gone down, and they're able to concentrate more on stereotactic biopsies and stuff like that. And 2026 is a landmark year where the governance is really taking a big role. Everyone has started realizing the value of regulation. So it is not one particular event, it is the life cycle. So the radiologist gets involved right from the beginning, right from the time a clinician is referring a patient, acquisition of images, interpretation, triaging, urgent ones go to the top, reporting, escalation, and follow-up and audit. See how we are doing. So this is a life cycle, and AI is coming in every step of the way. It is strong today because of these so far. Again, this is going to change. When I come back, when Chinnababu invites me next year, so I'm sure it'll be totally different. We'll be talking something totally different. All this will look very primitive then. The emergency CT, cancer screening, quantification, segmentation, I think Oncologists, they know what is segmentation. I don't want to repeat that. Quality and acquisition. So we are doing a lot of AI, integrating it in the equipment. Philips and other Siemens, all these equipments are now coming integrated. Quality is improved, radiation dosage is improved, image quality, pixels. It's amazing. It's almost like looking at a 7 Tesla MRI nowadays. So we have moved from algorithm to clinical service. So what do? We do detection, prioritization. Urgent cases go up, like an aortic aneurysm pops up on the top of my list, or a pulmonary embolism, it automatically comes to the top of my list. If I have about, say, 40 scans to report, I don't know which scan is holding what mystery, so it comes automatically. Reporting. So the number of complaints have gone down. The number of patient deaths have gone down. The morbidity has gone down. Look at the upside. Let's not talk about AI replacing us or replacing someone else. No, that's not the question. How is it helping us? That's the big question. And we should be smart enough as human beings to know where to draw the line, where to give importance to AI, where not to worry too much about AI. Reporting. So interpretation, it assists a lot. A lot of people, they like it, especially non-radiologists, because they don't have to go to a radiologist asking for a report. Radiologists are not very nice people, I think. I'm not too sure. That's what in UK people say, but I'm not sure about India. Governance is the key, that's the bottom line. Regulation is key. Without governance, nothing exists. And that's the reason why in UK, most of the software programs are not validated by MHRA, because they're so strict about governance. The new generation, traditional AI foundation models, which we have discussed already, see how we have traveled from traditional to 2026, 2028. Now we have Copilot, we have the workflow concierge, we have quality monitor, we have protocol assistant, we have patient bar. Everything is embedded. So Google Copilot is embedded in my PACS now. If I put some sentence, it stops me. It says, sorry, you're talking some nonsense. It corrects me. Shandu is here, so a big thanks to the Google team for that. It's really taken away a lot of stress from a radiologist. So again, AI is evolving from image interpretation to workflow intelligence. And where it delivers value today, detection, triaging. Triaging is something amazing. The UK has a massive backlog. Now, with the help of AI, I think the managers and the chief executives are all desperately trying to bring down the backlog. It is working, and people are claiming credit for that. So thanks to the engineers who have helped us a lot. What are the clinical benefits? We make early diagnosis. Searching is less because it does all the searching for you, and it's consistent. 24/7, it never gets tired. Human beings get tired. Better follow-up and faster escalation. No excuses. I was tired, or I was driving, I was on leave, nothing. So instant. So this is the AI governance board, which is embedded in every NHS department in the UK. And this is the cycle we follow. So I don't want to go through each and every thing because of 13 minutes. So I would say that the governance process, as has been clearly elaborated by my previous speakers, is absolutely key, and it should be robust. So opportunities, there are three things, opportunities, risks, and safeguards. That's what governance does. And if you can identify these three, then you can be the smartest clinician. I think that's where the success lies. And if we don't know how to use AI, then it's going to be a flop. So mammography has made significant, AI has made significant inroads into mammography. So you can see that cancer detection has gone up, and the workload has gone down, the more spare time for the breast radiologists. False positives have also gone down. We did a massive study, 80,000 patients. So clinical success depends on integration. So it's integrated to the scanner, it's integrated to PACS, to Soliton, to the reporting system, to the AI engine, then to reports itself, and finally the clinical action, like What do you do management-wise? What do you do? So that's called clinical action. So the best AI systems are invisible. If a system is visible, then it is not good. It's not great. So it should just blend in with the radiology system. And always remember, when you are introducing AI to a department, always start small. Don't try to bring in a huge project. Don't do that. That will be disastrous. Start small, scale safely, and keep doing QAs, and then build the future. Because buying AI is very easy nowadays, but what matters is, are you able to measure it? Are you able to regulate it? So the 3 hard truths, which all of us have to accept with AI are, AI will not fix a broken workflow. It's only going to make it worse. It will exaggerate mistakes. So please remember, AI tool without monitoring is a temporary experiment. Don't do that. And then the future belongs to radiologists who can combine imaging expertise with systems thinking. So yes, all radiologists in UK are now mandated to do training, AI training. From automation to human AI collaboration, the secret is AI and human. As my previous speakers highlighted, AI with humans, that's the best combination. Neither of them alone will fail. So the collaboration is the most important thing. See, again, when it comes to regulation, this is a sticky point. Always I'm faced with these questions by the audience. If a radiologist gives a wrong report, who takes the eventual responsibility? It's like a pilot flying an aircraft. If there's a plane crashes, it's not the pilot always, right? It could be the manufacturer, it could be the weather, it could be the air traffic control, it could be a system fault, a mechanical fault. So why is the radiologist always blamed for anything going wrong with AI? That's something which has to be addressed. And still, this is a virgin area which not many people have really dared to go into. So there was a beautiful article there. When the radiologist disagrees with AI, who carries the risk? Still remains a $1 million question. And it becomes more difficult, more complicated when AI was right and the radiologist disagreed. So that's clearly asking for trouble from the coroner. So you will be invited for a cup of coffee by the coroner. Anyway, so the future radiologist is not simply someone who interprets, but he is going to be an intelligent leader. And 3 things: seeing disease, understanding disease, and anticipating disease. Anticipating disease is the future. And this is the future radiologist. And I end there. Perfect timing. Thank you.
Thank you, Dr. Sivakumar. Chairpersons, if you'd like to moderate the questions.
Yep. Dr. Shiva, I am Dr. Mallikarjun Reddy here.
Hi.
Right. So I think the second last slide takes the whole cake. Who takes the blame? Today, I think the whole AI scenarios where people have said, call it hallucinations. I don't think that's the right word. No. We should call it misinformation and disinformation.
Agree.
And wanton misinformation. I've been working on all these LLMs in terms of how do you decipher the data from and then give us the data to a clinician. Then I asked, do you really look at good papers, bad papers, good data, bad data? Nothing. It does not even look at the disclaimers of and neither it doesn't, at least the simplest thing is it doesn't even remove the retracted papers out of the whole model. So they are shooting off our hip.
Agree.
And then using our shoulders for it. I think there needs to be some guardrails for them to actually take some blame on the whole front.
I'm working on a big project and presenting it in Chicago this November. Myself and 4 other radiologists. We are working on it. So let's see what happens.
Yeah, I'll be speaking in Paris in the next 3 days. The European Society of Pediatric Urologists, so we'll see what happens.
Please defend radiologists. Before I wind up, I'm going to give a surprise. That's exactly what I said. The organizers have been very kind. They gave me 2 extra minutes. So I'm going to invite Chandu Tota and Matthias, please, both of you. I'm going to give something to Chinnababu for his efforts. So no one better than you to present it to him. Please, if I may call you to the stage.